With that, it is my pleasure to introduce Dr. Susan Van Dyke. Dr. Van Dyke is a board-certified dermatologist with over 2 decades experience in cosmetic dermatology. She is the founder of Van Dyke Laser and Skin in Paradise Valley, Arizona, is a frequent media expert, and serves on the board of the directors of the Arizona Dermatology and Dermatologic Surgery Society. Dr. Van Dyke will now share her insight into the 4 pillars of building a successful miraDry practice. Wait, Dr. Van Dyke, 1 second. I can't hear you.
I'm on mute.
Okay, there you go. You're not anymore.
You can hear me now.
We can.
All right. Well, thank you. Thank you. And I'm really glad to join everybody there. I've got to tell you that, you know, webinars are not my favorite way of presenting because I can't see you. And this is the first time that you've been able to see me in a webinar. So I'm just going to imagine that you're paying attention, and I'm going to try and anticipate your questions and kind of address your needs. So what we're talking about today, 4 pillars to a successful miraDry practice. I'm not going to be talking about the science. There are other webinars that really do a great job with that. I was asked to really talk about the practice of miraDry, how it fits into what I do and how I promote it and really get it accepted by my patient population. So I am actually an MD, and I am board certified in dermatology. Now, I started out in internal medicine, and I switched over to derm because, you know, dermatologists have a lot more fun than internists, and it was a decision I have never regretted. Donna mentioned that I have over 2 decades of experience in cosmetic dermatology. Well, actually, I've been in practice for 3 decades, and that first decade, there really wasn't a whole lot to do in cosmetics. Cosmetic dermatology hadn't even been invented yet. We had Zyderm, and we had sclerotherapy, and that was it. So why do you care what I think about this whole subject? You know, I'm sure you're scratching your heads, like, what do I know that you don't know? I've just been at this a long time, and I am a practicing 100% cosmetic dermatologist, and I see patients. So I'm not an academician. I don't do a lot of research, although I have participated in a number of studies over time. And we've published some papers in peer-reviewed journals that I'm very proud of. I do address some of the major societies from time to time, but that's really, you know, my secondary thing. My primary thing is taking care of patients. So a little bit about really who I am and where I'm coming from so you can kind of understand my perspective. I am in Scottsdale, Arizona, which is in the middle of the desert. Scottsdale is right next to Phoenix. Actually, my practice is in Paradise Valley. Paradise Valley is a very tiny little town between Phoenix and Scottsdale, but they're really all contiguous. So founded in 1985, 10 years of general derm with whatever was cosmetic was out there. And then in 95, when the CO2 laser, the UltraPulse came out, I decided I'm not really good at doing everything well. I'm good at doing a few things well. So I closed down the general derm side, sent it all over to a friend of mine in town, and I did just cosmetic. At the time, I felt like it was jumping off a cliff, not sure where I would land, but it was the right decision. So what about Scottsdale? Well, Scottsdale has a population of 220,000. As I said, it's right next to Phoenix, so we've got really millions of people around us. The majority of patients, 62% of them, are over the age of 45, which skews a little bit older, but that's pretty much where the country is going anyway, is we baby boomers are definitely taking over. The median income's almost 100,000, and the homes are about $500,000 as far as median, and unemployment is quite low. So it's a pretty affluent community. This is actually the view from my backyard, which is a golf course in Camelback Mountain, and this is why we live here. My practice is composed of, well, we have a patient list of 20,000, and we didn't collect that until the last 15 years. But 4,800 of them are on my active email list. And that's really important because that's how I stay in touch with my patients. In the last 12 months, we saw 1,500 patients, but it was in 5,400 appointments. So that says to me that these patients need to be engaged on a regular basis. They see me on average 3 to 4 times a year. I cannot do a procedure that doesn't have a great outcome, or I lose them for everything else I see them for. So I'm very conscious of making them happy. It's about customer service. It's about experience and professionalism every day for every patient. It's not a plastic surgical practice where you can do a facelift and they'll see them again in 10 years. It's real time. 75% of my patients are over the age of 45. Again, skewing a little older, but that's probably because I skew a little older, and our practices reflect us to some degree. 85% female, and that's an interesting change, actually, because when we did this demographic last year, it was 90% female. So the male population is getting interested in cosmetic dermatologic procedures for a lot of reasons, non-invasive, and no one else knows they had it done. So welcome to my office. Actually, it's my office that we're sitting in right now. The lobby is made to be non-medical, non-clinical, very comfortable. You can see I've got an ego wall, and what that has on it are copies of magazines that I've been in, national magazines where I've been quoted or featured or somehow mentioned. And I do that because I want to create credibility right away when someone comes in the office, that they know they're talking to someone that they can trust and is an expert in what they're doing. Got the big logo on the wall, just in case they forget what office they're in while they're waiting. And this is the seating area in the lobby. You'll see that it does look like a living room, which people like. They always tell me they feel very relaxed in my office, and that's the key. I don't want them anxious. If you look closely, there are no magazines. I did away with them a number of years ago because I want them to focus on what I do and what we can offer them. All the books on the table there, those are picture books, before and afters of all the procedures that we do. On the wall, we have a television. It's not playing cartoons or movies. It's not showing the news, except for the fact that it's a string of news clips that I've been featured in over the years. And we have occasional videos of procedures that come from the companies. I thought that people would complain about this. You know, there's nothing to do in the lobby. I have not had one single complaint in all these years. They don't have anything to do. They're very engaged, and they very much want to know what else I do. Now, my practice is 100% cosmetic, so one would expect that these are the people who really do want to hear about cosmetic procedures. It's not general dermatology. So further on the profile, skincare. I'm a dermatologist. If I don't talk about skincare, it's a disservice to my patient. It's as if a dentist saw a patient and then said, I don't care if you brush your teeth or not, just come back after 3 or 4 months. No, I do care about what they do every day. And as far as my facial stuff goes, their skincare really enhances their results, which makes them happier with the procedure, makes it happier with me. About 10% of our revenue comes from skincare, and it actually could be a lot higher. And actually, it's going up a lot quicker right now because the staff is becoming more engaged. And staff engagement is huge on success on any level. Injectables are about half the practice. Botox, Dysport, of course, and then all the fillers. Voluma has been significant for us. It's really encouraged patients to go ahead and get additional filler rather than what they're used to, which is do their lips and nasolabials and they're done. Now they're coming in also to have the mid-face revolumized. It's been phenomenal. But really, you know, my practice is called Van Dyke Laser and Skin Care. Laser is the prominent part. The laser thing, I've always been interested in machines. My first laser I acquired in 1987. That was a continuous wave CO2 laser. That was a machine that we burned off tattoos and left horrible scars or warts and left scars on the bottom of the foot. And the patients were very happy because that was the only alternative. I've had a lot of machines over time, as you can see. They've not all been great successes. I've made some mistakes. One would be the Thermalase Soft Light, if anybody remembers that. That was the original hair removal laser. And in 6 months, I made a ton of money. And in the next 6 months, I gave it all back because it didn't work. Also, I was in on kind of the early days of the IPL. We nicknamed it Photo Burn. It was a great machine, worked really well, but kind of, difficult to use, very user dependent. So burns happened a lot more frequently than they do now. And then you can just read through that, a variety of skin resurfacing and some body treatments. These are the machines that I have today that we use actively. And my Thermage is not the original 2002. All of them have been upgraded and the newer models have been put in place. Our newest acquisition is the miraDry, which was earlier this year, about a little bit over 5 months ago. I really got interested and actively involved with body treatments fairly recently, and that was with cool sculpting about 3 years ago. And I was reluctant. I did not think that my patients were interested in the body. We put out a little questionnaire and said, what would they be interested in? They said, absolutely. So we did cool sculpting, then liposonics, and now miraDry actually fits very well into that whole body beautification kind of angle. So let's get on to the 4 pillars to a successful miraDry practice. So what 4 pillars are we talking about? Well, these are recommended by the miraDry people. Let's talk about these things. So, the invitation said innovative marketing. I've really reinterpreted that as creating awareness, because after all, that's what marketing is. It's getting people to know that you are there and that you have something to offer and that they need what you have to offer. Secondly, patient consultation. So once they're in your office, how do you close the deal? Engaged staff is crucial. There's nothing that I can do if my staff is not behind me. There was a patient in the office the other day who had been to a plastic surgeon's office, and when she left the presence of the plastic surgeon, the nurse said, I don't think you should do this procedure because she's seen this or that, and so the patient didn't do the procedure. I mean, that is staff that is not engaged. That is staff that is not behind your concept, and that is not what you need. And then lastly, superior clinical outcomes. There's absolutely no point in marketing something if it doesn't work. We can go back to my old thermalaze days. We learned that. So we'll start with creating awareness, which is kind of one of my fun subjects is marketing. Creating awareness. First of all, it's miraDry's job to get it out there in the popular press, as far as I'm concerned, the popular media, the Today Show, news channels, that kind of thing, on a certain level, and also to get into the bigger fashion magazines or the gossip magazines. Maybe get a celebrity or two to try this. This gives us name awareness, so that when you say miraDry, people don't look like, who made this up? I've never heard of it. When we started with Ultherapy, we had a little bit of the same problem, that people had never heard of it, but they rapidly got themselves into a lot of these same magazines that miraDry is now showing up in. And the women who are fashion conscious saw it, paid attention, and followed it. Now the second thing, once miraDry has done what they're doing, is that we have to take it into our office. So the very first contact that a patient has with our office is going to be on the phone, and that's the live contact. A lot of times they interact with us via internet before they call, but they're calling up, they're getting a live human being, and they may be scheduling Botox or something. We put them on a brief hold, and while on hold, we better make sure that the message on hold is mentioning miraDry about it's a new procedure, how great it is, and how much you actually need this particular procedure. I think you can see on the lobby desk there, this is their check-in, check-out desk. As Irving's on the phone, the patient might be standing there and she's reading about our current special or about an upcoming event. We want to attack them from all sides. When they're in the office, we want to keep things kind of neat and clean. I am not a big fan of a lot of clutter. This is our back counter, and they have got to go by this large banner that says miraDry when they enter and when they leave. There's no escaping it. Very simple, very clear. The message is there. It's almost, I can't say it's subliminal, but in a way, whatever they're in the office for, they're seeing something about miraDry. We have done some print ad, and miraDry does a nice job of a portal. You can go on and you can get customized print ads. You can get radio ads. You can get forms, things you can put in your office, brochures, et cetera. So that we have access to, too, which the company has done for us. So we put an ad in our local magazines, so Scottsdale, Scottsdale Health, and then we take the ad that's run and put it in a display and put it in the office, and it's branded. It's branded to us. So Van Dyke Laser and Skin is there. We want people to associate the treatment with us as opposed to the fly-by-night spa down the street. They know that this is a very well-established, good reputation practice, and therefore miraDry gets the benefit of that as well, and we get the benefit of miraDry's national marketing. We are very successful with events, and I find that this is a great way to basically call to action patients. We had our Combat Sweat and Fight Fat event, which was a couple of months ago, and we combined cool sculpting, miraDry, and liposonics. So the patients may have been interested in the cool sculpting, but what they're going to hear about is also miraDry. I've got a captive audience. I'm going to tell them about what's new in my office, and they're going to listen. Last month, we did Aging Gracefully, whole different subject matter, geared toward the older patient, but also look that in the middle of that is sweat reduction. So again, they're introduced to this subject, even though this may not be their primary interest as of yet. At our events, most of them, we're doing a lot of lunch and learns now. We found that we get a very high attendance at lunchtime. We're doing one tomorrow, and we've got 70 people who've RSVP'd for it for a 1-hour lunch. We give them free food, and we engage them, and we reward them. So they'll come in and they'll register. The registration captures their demographic information. Now, most of these patients are going to be coming because they got an e-blast from me or a newsletter. So they're my patient population, but they do bring friends. So we get those folks too. Besides, we want to track, is this event giving us what we want it to do? Are we getting a return on our investment? This is about miraDry, how many people are scheduling miraDry, that kind of thing. So when they register, they're reminded with brochures and little signs of what our specials of the month might be, as well as what they're going to hear that day. The educational talk is the main focus of our seminars, whether they're happy hours or lunch and learns or our huge annual open houses. I talk. I get up and I show slides and tell jokes and inform them about what the procedure is. And you can tell from this picture, these are very, very engaged people. They come because they want to hear, they want to learn, and they want to buy. So this is my same lobby that you saw a while ago with all the furniture. My staff is fabulous, very integral. They clean out all the furniture, they set up all the chairs, and they're assisting me as I'm giving a lecture on a subject. And also we give away things, which is the reward for the patient coming. And we've got Kelly there standing next to me in the black, and she's one of our MAs. She and all the other staff will then engage the patients or the guests who are at these events. And the staff loves it because it lets them show off their expertise and get one-on-one on people when maybe they don't have that chance during a regular day. Actually, they love them. They consider them fun. We often have demos. Patients want to touch and feel things. They may want to feel how a little zap feels on them. They want to talk to the provider. We also you have a live patient who can talk about that they've had it done or in fact having the procedure done as we're speaking, and you can talk to the patient while they're having the treatment. How's it feeling? Oh, it's great. I'm comfortable. No problem. That goes a long way to alleviating fear in patients who are not familiar with a particular procedure, particularly something like miraDry. It's microwaves, which is a scary term. I never, by the way, use that term when talking to patients. It's electromagnetic energy. And no one's ever asked me, actually. More rewards for my people who come to seminars. There's a special that day. Maybe a savings on miraDry, savings on some products. We usually combine products as well. And this is the call to action for them to do something that day only. What do they have to do? They have to pay. They don't have to schedule. And we certainly don't do any procedures on that day except the demos, but they pay in full with a discount. If they want their money back later, it's fine. It's their money. They get it back. But on the day, they lay down the money, and usually once the money's down, they don't ask for it back. They come in and they get the treatment. There's also an interesting thing, just go back for 1 second about these seminars, is that there is a bit of a herd mentality that we have people there who've had procedures and they're very enthusiastic and they encourage the others to do them. So that's a positive, having a group together. Now, what about outside the office? How do we get new patients? Every time I have an opportunity to talk, I talk. We do talk shows. Unfortunately, now a lot of them you have to pay to play. You have to pay to be on. I won't do that. I'll only do it if they ask me as a guest, expert guest. And every time we do one of these, we get the clips and we put them to use. I do a lot of news shows. News shows are fantastic. You get a lot more traffic to a news show. A lot more people will watch it. This is me last week standing outside the, obviously the studio while they're actively filming, or not filming, they're live, and waiting for my turn. So they put me out on the plaza, and the plaza is not like the Today Show Plaza, believe me, but that's what they call it. So I'm outside, and the subject for this one was men and cosmetic procedures. I talked about Voluma, I talked about Ulthera, and unfortunately a little bit outside the picture, there's a skin model with sweat glands, and there's information about miraDry, and I talked about miraDry. After my 1 minute of fame on this show, the news anchor was so intrigued with what we had to do that she actually is bringing a news crew to the office Thursday to do an extended segment that will air, and we'll probably get 3 or 4 minutes out of that. So what do I do with my news clips? Well, everybody knows what YouTube is. All of these news clips get put on YouTube. We have a YouTube channel, so if you were to Google or look for Van Dyke Laser and Skin, or me personally, Susan Van Dyke, you're going to come up with our channel. You're going to see a bazillion little clips on all kinds of subjects, from skin care and skin cancer to, of course, every procedure that we do. And then see the television in the lobby? Yeah, that's what is played. It's playing a YouTube loop. The other thing about YouTube is you can link it to other things. You can link it to your website. So here we have a miraDry video that I did for Fox 10. If you Google miraDry, you'll eventually find my particular clip, and then this one is linked to the website. So patients don't want to read anything anymore. They want to be shown, they want to be told. It's all about the visuals. So they can learn a lot just by coming to the website. Speaking of the website, I've seen a lot of fabulous websites. We like the banner. This is the banner of miraDry. This banner does move, so other procedures will come up every few minutes, and then it'll come back to miraDry again. It really catches their attention, even if they're coming to my website for a reason other than miraDry. And it'll intrigue them. They'll click on it, and then they'll find the video, and then they'll see it done. On my website also, we have a blog, and a blog is a no big deal. It's just me talking about things that I think are interesting. And I turned 60 this year, so I wrote a year-long thing on turning 60, and one of them was turning 60 is no sweat. I talked about my experience with miraDry. Yeah, I've had it done, and how happy I was with my results. Patients love this when you do things and talk about it. The blog is also connected to an e-newsletter. We do an e-newsletter every month. It's very easy. We use Constant Contact. You can do it yourself, or we have a PR firm that helps us out with it. This has my blog. This also has upcoming events, and it may have one of the staff's favorite procedures or products, and all the upcoming events, of course, are highlighted. Facebook, got to have a Facebook page. I have the same kind of thing, a banner across the top, and the Facebook is linked to lots of other things. We have fans and friends. We have reviews, and we have a great record. We have 5-star reviews, which is lovely. You can ask your patients to go on and give you a review, by the way, and it's a really good idea. Also on the website is not just informational, this is the Facebook, is that we put things about the practice or about staff that's interesting. So tomorrow our Facebook page will talk about that I gave a webinar tonight. We are very big supporters of charities, particularly Juvenile Diabetes Research Foundation, because I have a diabetic son, and we contribute a great deal of money, and then we put that on Facebook, and that's for social awareness and making us real people, not just a logo. There's Twitter. Twitter's connected to Facebook. If I put something on Twitter, it'll show up on Facebook and vice versa. Here I'm talking about an upcoming TV segment, and you hashtag it, and people look at sweat, they'll find me. We've got about 2,000 followers on Twitter. This is an interesting one, Yelp, and whether you like it or not, your business is probably already on Yelp, and you want to go find it and claim it if you haven't. When you claim it, you can put pictures on and you can describe your practice as you like. You can't influence the reviews, of course, but you can ask your patients to go on there and review you. So we've got 5.5 stars, 4.5 stars there. RealSelf.com is phenomenal. This is a site where patients can ask questions to doctor experts, and we answer. And they also rate different procedures. miraDry has a 98% it's worth it rating from their consumers, and it's the highest one of anyone I've ever seen. Very positively reinforcing for the patient when they see that. Second pillar, patient consultation. Okay, we've interested them out there, and now they finally come to your office. And now what do we do? Well, our providers do the consultations. I don't have a patient coordinator do it, although she does help out. These are the ladies, RNs, laser techs, who actually do the procedures, and they can talk about it in great detail and confidence. So originally, miraDry has been marketed as excessive sweater relief. This grossly kind of exaggerated for the normal person, sweat under the arms. Of course, there are people with hyperhidrosis. For them, miraDry is life-changing, but it actually is a relatively small percent of the population. I'm actually more interested in promoting it to the regular person. Everyone sweats. You know, some sweat excessively, yes, but everyone sweats and nobody wants to sweat. We don't like using antiperspirant and deodorant every day. So I want to address the other 90% of the population who sweat and, by the way, produce body odor, which they would prefer not to have. Our job is to show them that they need this treatment and that we are here to provide it for them. It's part of marketing. I like to highlight these are celebrities. I guess you can't call them normal people, but these are normal sweaters, you know, not excessive. They just want to wear a nice silk blouse once in a while and not see this kind of thing going on. We talk about the side effects of deodorant. You know, these are not critical, but any woman with a black t-shirt, a little black dress has gotten this little white smudge, and it's really annoying. That's what deodorant does to you. The t-shirt is my son's, and nice yellow stains under his arms. That's the aluminum chloride combined with the sweat making yellow stain. Without the aluminum chloride, there's no yellow stain. So deodorants, you know, they work by causing swelling of the lining cells of the eccrine glands as they empty into the skin. So you're literally getting edema in the cells that close off that conduit for the fluid. Doesn't sound like a good thing to me. When you explain to patients what antiperspirants are doing, they're usually pretty surprised that it works by edema. Number one question I get, isn't it unhealthy to stop sweating? Well, sweating is for body temperature regulation, and when you need your body temperature regulated, you sweat from everywhere, not just your armpits. So I explain to them, 2% of your sweat glands are in your armpits. If they don't sweat as effectively as they used to, is it a problem? No, not a problem. In the consultation, you want to explain it's a simple 3-step procedure. We mark off your armpit. That makes it customized for each individual person. Number 2, little local anesthesia, a little pinch, not a big deal. We use kind of a semi-tumescent, it's a 0.1% lidocaine solution, and we usually will put 50 to 100 cc's in each armpit, and it's a 100% painless procedure when that's done. And the treatment itself is only about 20-30 minutes on each side. It's very easy. My staff loves doing it, by the way, because they get to sit and chat with the patient, and it doesn't take very long to do. And the patients are happy. Of course, you have to address side effects with the patient. They're not concerned about swelling, soreness, or numbness as long as they know it's going to happen. And we expect it, and I've not had a complaint. Then we talk about the significant side effects of miraDry. It reduces body odor. That's really not what the FDA approved it for, but it does. And I don't know if you've heard this, but Brad Pitt kind of has a reputation for having body odor because he doesn't like deodorants. And then the other side effect you could call is hair reduction. Here's Julia Roberts, and she could probably use a little hair reduction. You know, all of my patients have laser hair removal on their underarms, so we really haven't seen it, and the guys don't seem to care, but that is actually a side effect. So what can patients expect? Well, the permanent results are the thing. Yeah, it lasts forever. You kill a sweat gland, it's not coming back. And there's plenty of evidence to show that they're not coming back. Immediate results right after procedure. You don't have to wait. And minimal to no downtime. Side effects are really quite acceptable. So consultation, create the need, and give them the solution for their need. Engage staff. You can't sell something unless your staff's engaged. So I have to make them happy. I want them to love their job, love the patients. I want them to be positively reinforcing to me. So we appreciate them greatly, and we show that. We do team building things. We do happy fun days together. And we learn things, but we also learn about each other. The last one we did, we had a video team come in and we videotaped everybody, little segments about what's their favorite product or what's their favorite procedure. And we're going to finish that up and put it on the website. This makes the staff know that they are an integral part of the practice. They're not just there to be handmaidens at all. Back to the front desk, phone contact is the first contact. We script responses so that they have confidence when they answer the phone. They know when to refer to a medical personnel or when they can answer the questions themselves. Staff meetings and services, huge. We educate the staff on the procedures all the time. Staff meetings every week, in services with vendors at least every week. Front office, they engage patients. They don't just answer the phone and schedule. They contact and they make the patients love the practice day one. Welcome to our office. They get out there. They have iPads with miraDry videos on that they can show the patient. They can casually interact with them and tell them their own experiences. Back office is supportive. I'm sure everybody knows this, but the patients ask the MAs what they think when we leave the room. We want to make sure that they think what we think and that they have every confidence in us and our procedures, miraDry being just one of them. And the providers, they're the ones who develop the trust. And the patients come to love the providers. So we need to love them too. Here's a big, big thing. You got to treat your staff. They know what the procedure's like. They can talk about it with confidence, and they can brag about it. And they also get a free treatment, which they like. Lastly, superior clinical outcomes. No point in doing something if you don't get results. The hyperhidrosis disease severity scale, it's simple, 1 to 4. 1 is sweat doesn't bother me, 4 is my life is ruined. Most people are 1s and 2s. A lot of the studies were done on 3s and 4s. But you can see from this hyperhidrosis scale how effective miraDry is in reducing sweating and how it lasts up to 24 months and longer. Another scale that judges the efficacy of this procedure is the Dermatology Life Quality Index. It's subjective, yes, but patients fill out a questionnaire asking how their particular skin condition, in this case sweating, affects their life. In the studies, a drop in this score of 5 points is significant. This is a dramatic drop, which means that their life quality has improved dramatically from day one, from getting miraDry and reducing sweating, and it lasts for forever, probably. And of course, there's scientific data. The sweat glands are not working even up to 3 years and beyond. And then, of course, there's histology that shows the sweat glands are gone. Long-term efficacy, it's about patient satisfaction. I can show you all the studies in the world, but if the patient's not happy, it doesn't make any difference. At 24 months, unsatisfied, less than 5%. That's pretty remarkable for any cosmetic procedure. And then the secondary, the odor. That's a drop in odor. We went from lots of smelliness at red to not so much at green, and again, persistent over time. So highly effective, highly predictable. You can be very confident the patient is going to be happy, and it's a straightforward procedure. So it's a good investment. The fifth pillar wasn't really part of my talk, but I'm just going to really zip through this. We started doing this in May. We treated our staff first. If you know anything about Arizona, nothing happens in June, July, and August. People come back in September, but we've steadily been doing patients every single month, and we're starting to accelerate that now. And of course, the income is paralleling the number of treatments we're doing. Of the patients that we've done, about half were new, about half were established. So this is different than what we've been talking about. I know a lot of the comments earlier with miraDry that 80%, 90% of your patients are going to come from outside your practice. We did not find this. We can market this to our normal, typical cosmetic patient when it's couched as everybody sweats and you don't need to. Of the new patients, it was almost 50-50 male-female, actually a little bit more male, different from our normal demographic, which is 85% female. So here's a way we're bringing men into the practice to expose them to other things that we can do. And of our established patients, they were all women. Women very interested in this, and they're women who are sweat bothered, not hyperhidrotic. We want our established patients, we want engaged. These are people who spend $7,300 on average on other things in the office, and they're interested in miraDry. That hopefully flips the other way. Those new ones coming in interested in miraDry are going to cross over, cross-pollinate to other procedures and things that we do. The new patients so far, on the first day in the office, 8% of them bought products, and an additional 8% scheduled other procedures. So we definitely are seeing crossover. I believe this is going to increase significantly with time. I see nothing but potential. We can attract new aesthetic patients, the sweat-bothered patient, the younger woman in particular, and men. The men sometimes are more on the hyperhidrotic side. The women are more conscious of they don't want their clothes ruined. Appearance conscious and discretionary income. We've gotten no pushback whatsoever on the cost of miraDry. We always recommend 2 treatments. 1 might be okay, but 2 is better. And I do tell them occasionally there's a 3rd treatment for some. But if the person is happy in 1, they're happy. They're happy in 2, they're happy. I've warned them that's what they're going to need. So I see nothing but upward spiraling of miraDry as it becomes more of a household name, as people understand that they have a need that maybe they didn't know they had last year, and that we are the ones who can fulfill that need, and it works. It absolutely works. So just in conclusion, yeah, I'm from Scottsdale. We live in the desert. It's a dry heat, and so there's not a whole lot of sweating going on here, certainly not since we started doing miraDry. And with that, I'm going to turn it back to our host, Donna, and see if we have any questions.
Perfect. Well, thank you, Dr. Van Dyke, for a great presentation.
Thank you.
Now we'd like to take some questions from our audience. I actually noticed that we had a question. It says, how big of a barrier are the lidocaine injections? Have you experimented with topical lidocaines?
Okay, so how big an objection? It's all in how you present it. That is the thing that people are most afraid of. But when they speak with my staff, who've all been treated, they can look them in the face honestly and say, yeah, it's a little pinpricky, but then it's completely numb and it's no big deal. The way we do it, because we're doing kind of a tumescent, they don't get stuck a lot. You know, it's a small number of pinches, and once it's numb, you can go ahead and do the rest. So we have not found that to be a particular barrier. On the second part, have we tried topical lidocaine? I think it would be a terrible waste of time. This heat is deep at the dermal subcutaneous border, and it's very hot. You know, we're 65 degrees centigrade. I can't get topical to work with Thermage or Ulthera, which are not as deep or are in the same neighborhood. So I don't think that's going to help.
Okay. I have another question. What do you charge for the procedure?
Well, typically, you know, I think in general the cost is going to change, obviously, from area to area, but we sell it as a package of approximately $3,000. If they want one treatment, they're paying $2,000 almost. Why do I do it that way? Because I want to reinforce it's 2 treatments. You know, buy the package. If you do one and you want your money back, you won't get half of it back. You'll get the cost of the second treatment back. If you want to do single treatments, then you will be paying single treatment payments each time. So almost 100% of them will go for the package. That also engages them that they're going to come back and do that second treatment. They're not going to do one and then walk around and say that it doesn't work. And then if they're happy and they want their money back, it's their money. I give it back to them, absolutely. So.
Terrific. And another question on your events. What percentage approximately would you say sign up for a procedure during an event?
It can range anywhere from 40% to 80%. These people are coming because they want the procedure. So it's actually very high. Sometimes it's been amazing to me how much they want to put down. And then they also buy other things. They buy products too when they're in the office. The only special would be on the procedures that we're doing though. So.
Terrific. Does anyone else have questions? We welcome your questions. Well, with that, thank you for attending our seminar this evening. We hope you found it interesting and informative. After you log off, you will see a survey. We'd love it if you would complete the survey for us and help us understand how we can improve these seminars. I'd like to thank Dr. Van Dyke for her time and effort in preparing this terrific seminar. And as I mentioned, this seminar has been recorded and will be available on our website. It was our pleasure to host the seminar this evening. If there's anything I can do to help you, please don't hesitate to contact me directly at dlevy@miramarlabs.com. I thank you and have a good evening.
Thanks. Good night.
Good night.